Depression affects many people. Depression is sometimes referred to as an invisible illness. Someone may look like they're happy on the outside, but on the inside they're sad, hopeless, and exhausted. They may have lost interest in things that they used to love, and they may feel like their situation is hopeless. Every year, over 18 million, or 1 in 10 Americans, are diagnosed with depression. My name is Jessica, and I am 1 in 10. Since my diagnosis of depression at age 13, I have battled it with a combination of medication, cognitive behavioral therapy, and daily behavioral goals to help cope. 3 ways to cope and manage depression are with medication, cognitive behavioral therapy, and setting daily or weekly behavioral goals. Today, we will discuss first, medication, next, cognitive behavioral therapy or CBT, and finally, creating daily or weekly behavioral goals. Much of the information I'm going to share with you today has come from the Association for Anxiety and Depression, the National Alliance on Mental Illness, and the Centers for Disease Control and Prevention. Medication can be used to help control and lessen the physical symptoms of depression. Medication is often prescribed by a doctor. Many forms of depression respond to treatment with antidepressants, such as SSRIs or SNRIs. According to the Anxiety and Depression Association of America, 1 in 10 people between the ages of 18 to 44 choose to use antidepressants. Some examples of common SSRIs that you may have heard of include Prozac, Zoloft, and Paxil. Some examples of common SNRIs include Effexor and Cymbalta. The National Alliance on Mental Health states that antidepressants usually take between 2 to 4 weeks to have an effect on reducing or controlling symptoms. Many people find that they need to try a few different types of medications before they find one that works for them. When I first started to take antidepressants many years ago, I found that I didn't like some of the negative side effects that occurred as a result of taking certain medications. Some of the side effects included weight gain. I had to try at least 3 different antidepressants before I found the proper fit. For some individuals, medication alone is not effective enough to treat depression symptoms. Therapy, specifically cognitive behavioral therapy, is used usually alongside with medication. Cognitive behavioral therapy is often recommended with medication so a person can understand the behaviors and thoughts that can contribute or are attributed to depression. CBT is a form of psychotherapy or talk therapy. In psychotherapy, according to the National Alliance on Mental Illness, the therapist leads a conversation which can focus on a person's past or their present, their relationships, their feelings, and it can often help that person make a connection to their depression and the symptoms of their depression. CBT focuses on the connection between thoughts and behaviors and how self-monitoring these behaviors can lead to an understanding why negative thoughts occur and when they occur. During therapy, I learned to keep a journal of situations and my feelings during these situations to identify patterns of negative thinking. CBT is effective at treating depression because it works on reconstructing negative thoughts and reframing them into positive ones. One of the biggest negative thoughts I had during therapy was the fact I felt guilty about spending time away from my children, and CBT helped me to reframe those negative emotions. CBT helps to reframe thinking by also asking a person to come up with positive daily or weekly behavioral goals. Goals can be small, such as exercising 3 times a week, committing to eating a healthier diet, and leaving the house. I personally set several goals for myself per week, such as committing to going to bed early or drinking water, for example. I posted these goals somewhere I could see it as a reminder, such as my refrigerator. A depression care action plan can be an aid in setting clear, concise behavioral goals. The action plan can be devised by the therapist and the patient, or just the patient themselves. Behavioral goals often focus on the mind-body connection, and they can include techniques such as relaxation, yoga, and focus on diet and exercise. Personally, I like to do yoga to combat my depression symptoms, and I make it a goal to practice at least once a week. There are three main strategies in coping with depression that we discussed today. First, medication. Next, cognitive behavioral therapy or CBT. And finally, creating daily or weekly behavioral goals. Depression is a difficult illness because the effects of it are not often visible. However, it is a chronic illness and should be managed in the same manner as diabetes or cancer. Although depression is chronic and lifelong, people are now engaging in open and honest discussions about it and the ways in which to cope with it. With knowledge comes power, and I am confident that the stigma behind depression and other mental illnesses will soon be a thing of the past. Thank you.